Over the next few days, the Australian Government, together with the state and territory governments, have an historic opportunity to fundamentally reform our nation's health and hospital system. For generations, our health system has been held back by cost shift and blame shift between the two levels of government. We simply can't afford for this to continue into the future. The blame game must stop. Cost shifting must stop. Duplication and waste must stop. And we must act on the reality that the cost of health will soar into the future as our population ages. I'm simply not going to leave future generations of Australians with a broken, financially unviable health and hospital system, because the easy way forward is to do nothing. So today we have an historic opportunity to act, to fundamentally reform our nation's health and hospital system. Under our plan, for the first time ever, Australia's hospitals will be funded nationally and run locally through a new National Health and Hospitals Network. This will mean more money for our hospitals, coupled with strong reform to deliver a better hospitals network. It will mean 6,000 new doctors, 95% of elective surgeries carried out on time, and a 4-hour cap on emergency department waiting times. Critically, under our plan, the Australian Government will become the dominant funder of the health and hospital system. To do this, we are seeking to retain 1/3 of the GST. That means the Australian Government becoming responsible for 60% of public hospitals funding into the future. But because the ageing of our population is driving up the cost of healthcare, more investment is required on top of this. In fact, the Commonwealth Treasury forecasts an additional $15.6 billion will be required over the decade ahead to sustain the funding needs of our nation's health and hospital system, over and above the 1/3 of the GST that the Australian Government will retain. So today, I'm pleased to announce that the Australian Government will meet that funding requirement into the future. That means, at a minimum, a further $15.6 billion investment into our nation's health and hospital system over the decade ahead. No ifs, no buts, no maybes, no cost shift, no blame shift. This will be signed in black and white in a new intergovernmental agreement between the Australian Government and the states. But first, we need the states and territories to sign up to these historic reforms. This guarantee is conditional on the Australian Government becoming the majority funder of the health and hospital system. We can only do this if the states agree now to the Australian Government retaining 1/3 of the GST. I'm hopeful that we can make the most of this historic opportunity by taking these big decisions now. No more delays. And delivering better health and better hospitals for all Australians. I thank you.